Contact tracing is an important part of our COVID-19 safety measures at Creighton University. So how does it work? I'm Angela Maynard, a registered nurse and certified contact tracer with Student Health Education and Compliance. Once a member of the Creighton community reports a health concern to coronavirus response at creighton.edu, either directly or after completing the daily Campus Clear screening app, the message is forwarded to the contact tracing team. In addition, when results are reported to COVID results at creighton.edu, the contact tracing team prioritizes the positive test results. What happens next? Anytime a report of symptoms that are consistent with COVID-19 comes in, the ill person is directed to isolate. We do not wait until a test result is available. We want to be very proactive in our approach. If the symptomatic person subsequently tests negative, another review of symptoms occurs and next steps are determined. Those testing positive for COVID-19 are also directed to isolate. Isolation lasts for 10 days from the onset of symptoms or the date the positive test was obtained, if there are no symptoms. Students and employees can return to campus on day 11 if cleared by Student Health Education and Compliance. With contact tracing, we call the person who is symptomatic or who tested positive for COVID-19 and conduct a very detailed interview to determine their movements 48 hours prior to symptom onset or prior to collection of the specimen that tested positive. We often ask people to access their calendars and text messages to help them remember what they were doing and who they were with. So who is notified of a possible exposure? Only close contacts of somebody who has symptoms consistent with COVID-19 or a positive COVID-19 test are notified of exposure. Close contact is defined as proximity of less than 6 feet for 15 minutes or more without the use of face coverings. If you are not contacted, it's been determined that you were not a close contact. If someone exposed has previously tested positive for COVID-19, a symptom screen is performed. Evidence of a positive test is requested, and the contact tracer determines next steps. Those who have been exposed but are not displaying symptoms need to quarantine for 14 days from the date of their last exposure. Because COVID-19 has an incubation period of up to 14 days, that duration cannot be shortened with a negative COVID-19 test. Students and employees can return to campus on day 15 if cleared by Student Health Education and Compliance. Creighton's contact tracing team is here for you. Our role is to keep our community safe. With the rise in positive COVID-19 cases locally and nationally, we must remain ever vigilant in following Creighton's COVID-19 community standards. Let's pull together and finish the semester strong.